Welcome to Maison Dental. I'm Dr. Glafira, and for today's video we'll be talking about night guards. Grinding and clenching are very common habits that your dentist may see signs of when you visit the dentist. Many people clench and grind their teeth without realising it. Symptoms may present as pain in the face, the shoulder, the neck. You may get headaches in the morning and earaches as well. There are a number of reasons why you may grind your teeth. The most common being anxiety and stress, breathing issues such as sleep apnea, certain medications including antidepressants, alcohol and recreational drugs can also cause grinding and clenching. Grinding and clenching can persist during the day as well. Have you ever noticed yourself clenching when you're working, when you're driving, and even at the gym? During the day, you can control how much force you place on your teeth if you notice it. However, at night, you may put up to 90 kilos of force on your teeth without realizing it. That's why a lot of people may present with broken teeth, needing fillings and crowns, and in the worst case scenario, may need to remove the tooth if it's broken badly. To prevent further wear and damage to your teeth, your dentist may recommend you a night guard. This one's mine. Like a lot of other people, I do grind my teeth at night. Funnily enough, the incidence of grinding and clenching has increased since the COVID-19 pandemic due to the stresses related to it, so you're not the only one. It fits to one arch of your mouth, either the top or the bottom. I'm not gonna lie, they're not the most comfortable things in the world, but like everything else, you'll just get used to them. Some of my patients have said that now they can't sleep without one. The night guard covers the biting surfaces of all your teeth, and the plastic absorbs the forces that you exert on them. Look, they're not going to stop you from grinding, but it's going to prevent the wear that you may place on your teeth. They should be reviewed and adjusted with your dentist every time you see them, as they may wear down unevenly, and which can cause more discomfort. What about those suck-down ones that you find from the chemist? Look, it's better than nothing, but they are made out of a soft plastic which is considered to exacerbate the grinding, and they won't fit as well as a custom made one. So please, if you have any questions, make sure you ask your dentist.